Last year, it was discovered that in patients with primary myelofibrosis without mutations in JAK2 or MAPLE, mutations in the calreticulin gene play an important role in the disease. What is currently known about the role of mutations in this gene and what is still unknown?
We know that CALR mutation, that is calreticulin mutation, are involved in myeloproliferative neoplasms, but the exact mechanism about this happens is not clear now, because we know that CALR is involved in the calcium metabolism and probably is important in myeloproliferative neoplasms. But much more needs to be done to answer to this question. But we have some few information about the prognostic role of CALR mutation in this patient, and we already know that the patient with primary myelofibrosis have a better prognosis when CALR mutation is present.
And what was the aim of the study you performed?
Yes, the aim of our study was to investigate the prognostic role of CALR mutation, but in presence of other subclonal additional mutation.
And what were the main results?
Yes, we have genotyped, so we have studied the mutational status of 11 genes that include the CALR, but also JAK2, MAPLE, and other genes that we know are mutated in myeloproliferative neoplasms. And we observed that we confirm the better prognosis of a CALR mutation in this patient. And we also observed that the presence of the other mutation associated in addition to CALR did not impact the favorable effect of CALR on overall survival. So this is an important information, because we know that some of these mutated genes are associated with a worse prognosis. And another observation, very important, that we have done, and that patients that have the other mutations, so that we have defined as high molecular risk patients, are more frequently included in patients that are CALR, JAK2, and MAPLE unmutated, the so-called 3 negative patient. And probably this is the real mechanism that is related to the worst prognosis of this patient, that present an overall survival that is less than 3 years compared to the overall survival of patient with CALR mutation that is more than 27 years.
What do these results tell about the presence of other molecular abnormalities in this disease?
Yes. The role of the mutational status of gene in myeloproliferative neoplasms have a growing interest in the last years, because most of the genes were associated with a reduced overall survival and increased risk to progress to acute leukemia of this patient. And there are a great effort to perform a new prognostic score that include also molecular information, but because now the international prognostic score that we normally use include only clinical variables or karyotypic analysis, and we are going to perform a new molecular prognostic score that is better discriminate patients with a better or worse survival.